Dr. Lakshmanan.
Thank you, Vice Chairman, sir. The 1956 Act provides for supersession of the MCI and its reconstitution within a period of 3 years. The bill amends this provision to provide for the supersession of the MCI for a period of 1 year. The bill amends to increase the strength of the board from 7... Thank you.
I forgot. I should have included Anna DMK also, of parties who are in the NDA board to abandon the NDA board on the
Okay, thank you.
The bill amends to increase the strength of the board from 7 members to 12 members. Further, it allows for persons with proven administrative capacity and experience to be selected in the board. The bill provides for the Board of Governors to be assisted by a Secretary General appointed by the Union Government. So the National Medical Commission Bill is still pending before the House. It is a comprehensive bill covering various aspects. That bill has been brought to replace the Indian Medical Council Act 1956. That bill itself contains various provisions that are opposed by medical professionals and other stakeholders. The bill was referred to Standing Committee on Health and Family Welfare. Its reports has been presented to the House. The bill, along with the recommendations of the Committee on Health and Family Welfare, are to be discussed in this House. When that bill is pending before the House, what is necessary for the government to bring this amendment bill, sir? Sir, myself as a medical professional suggest that the Board of Governors should include members nominated from Tamil Nadu and other states having more number of medical colleges. So now, I would like to point out few pertinent issues faced by the people of Tamil Nadu as far as the medical education is concerned. So the government of Tamil Nadu has taken consistent stand that rural students and students from low socio-economic backgrounds will be unable to compete with urban elite students in common entrance examinations like NEET. So the government of Tamil Nadu invested and created medical infrastructure facilities with adequate professors in various government medical colleges. Government medical college hospitals are built in all district headquarters, full-fledged hospitals in all taluk headquarters, and upgraded PHCs in rural areas across the state are providing free and best possible medical services for all sections of the people. After a careful study on the doctor-patient ratio, the availability of hospitals, particularly in rural areas, the requirement of medical professionals in the state are calculated and fulfilled through a very transparent system, sir. For admission to postgraduate courses, the government of Tamil Nadu gives preference to those who have served in rural areas, with special weightage for those who are working in hilly and tribal areas. The state government has also successfully obtained and enforced bonds from those completing postgraduate education in government medical colleges to serve the state government for a minimum period, which has helped us to meet the need for specialist medical professionals in government hospitals, particularly in rural areas and remote hilly areas for the benefit of people living there. So the national eligibility and entrance test for medical admissions would be a direct infringement on the rights of the state and would cause grave injustice to the students of Tamil Nadu who are already covered by a fair and transparent admission policy which has been working very well. Students from rural and poor socio-economic backgrounds will be unable to compete with urban elite students in the common entrance examination, as they will be deprived of the kind of coaching the urban students get from private coaching centers. These private coaching centers will be unreachable for poor and rural students on 2 counts: high cost and non-availability. Sir, I request the Union Government to permit Tamil Nadu through appropriate legislative intervention to continue its own fair and transparent system of admission to medical colleges and dental colleges in state at the undergraduate and postgraduate levels on a permanent basis and not be forced to implement the NEET. Had there been a common syllabus throughout the country, the conducting of NEET would be justifiable. In the absence of a common syllabus, any common entrance exam like NEET will always be untenable, sir. With this, I support this bill. Thank you very much, sir.
Thank you, Dr. Lakshmanan.